Hello. Today we have a very special program because we have two special guests today, and we are going to learn all about our heart problem. I don't mean sentimental heart problem. I mean the real heart diseases. So with me today is Dr. Narula. Hello, Dr. Narula.
Hello.
Welcome to our program.
Thank you.
Dr. Narula is the mind or the brain behind medical issues of the heart problem. And we welcome Dr. Patel,
Hello.
who is a well-known surgeon, heart surgeon. So with the two of them, we are going to bring to you all the recent advances and what you should be doing to take care of your heart. As you know, these days, heart problems, heart attacks are very common. And today we are going to demystify and let you know, better write down what Dr. Narula has to say. So once again, Dr. Narula, why is it that we are having so much heart problem we hear about?
So cardiovascular disease is the leading killer in the United States. And obviously there are many things that people cannot control, like genetics, that can lead to heart disease. But there are a lot of things that can be controlled, and these are the things that I like to focus on with my patients. There are several risk factors that are modifiable, as we say, or changeable, that can lower somebody's risk of heart attack, stroke, and cardiovascular disease. These risk factors would include diet, obesity, smoking, alcohol consumption, blood pressure control, cholesterol control. And we can go through each one of those and talk about how to change those. And by changing one or more of those, you can truly lower your risk of cardiovascular disease. So for instance, when it comes to exercise, we counsel our patients that they should be exercising at least 30 to 60 minutes of aerobic exercise. Aerobic to the point where you get your heart rate up, you're sweating a little bit, as many days of the week as possible. In terms of obesity, we recommend weight loss to help prevent cardiovascular disease by lowering blood pressure. Losing weight also helps to improve the cholesterol profile. So people can actually go on the internet and calculate what their body mass index is. And this is a number that we use to classify people as normal weight, overweight, obese.
Let's simplify the issue for them. Mm-hmm. You know, a lot of people think that if I take a little walk after dinner, that is good exercise. Mm-hmm. Is that sufficient?
It's good if you get your heart rate up, as I said. It's good if you get your body moving and you sweat a little bit. You know, any exercise is good. So yes, if you go out and walk a little bit, it's better than sitting at home on the couch and watching television. But as I said, we like to get the heart pumping as much as possible.
Maybe you should go up and down the steps.
Yes.
Now, the other thing was obesity. Mm-hmm. Now, could you explain a little bit what is obese and at what level?
Well, that's, there are different ways to classify what makes somebody obese or overweight. And as I was mentioning, there is a number that we can calculate, and it's based on your height and your weight. And if that number falls above or below a certain level, then somebody is classified as obese or overweight.
I remember that they simplified it that if your waistline in a man is more than 40, that's a bad news, and for a woman it's more than 36, that's a bad news. So that's a simple term of obesity.
Yes.
Or what we were talking earlier, mm-hmm. so-called metabolic syndrome. Mm-hmm. Anyway, I don't want to interrupt you, so let's go ahead. What are we going to talk about? Food?
Food. So
right.
Food is very important. Yeah. So obviously, low salt intake, less than 2 grams of sodium a day is important to keep the blood pressure under control. Low cholesterol diet, high in fiber diet, a diet that's full of fruits and vegetables which have antioxidants in them. And obviously avoiding foods that have high trans fatty acids. That's the bad type of fat. So no fried foods, really looking at the label to find foods that have monounsaturated fats or polyunsaturated as opposed to trans fatty acids. So cooking with olive oil or canola oil would be the way to go.
So I know a lot of our ladies are watching, and they are the one who control the kitchen.
Right.
So advice for them is that don't cook in the ghee, in the butter.
Yes.
Because most of our Indian community, they really love to use clarified butter, which is called ghee. So that's bad.
Butter's the worst.
What would you recommend? They should use olive oil?
Olive oil.
Or canola oil?
Canola oil.
That's wonderful. So ladies, throw away your ghee.
That's right.
Dr. Narula says you have to use olive oil or canola oil.
Yes.
Now, I also know that when they eat meat, for example, they have a chicken which has a lot of fat on it. And I remember that the advice used to be remove all the fat from the chicken, and bake it rather than fry it. So what do you think of the food which a lot of our young people are fond of, eating pizza, eating hamburger, eating Kentucky Fried Chicken? So what advice would you give it to them?
Yes, as I mentioned, avoiding fatty foods is important. So at least 5 servings a day of fruits and vegetables. Limiting the carbohydrate intake and fat intake would be very important. And no butter.
No butter. That's good. All right, what else? So we talked about exercise. We talked about keeping weight under control.
Yes.
Which is very important, of course. And then the diet. So what else should they be doing? And they smoke like chimney.
No smoking.
See, no smoking.
No smoking.
How bad is smoking?
It is the absolute worst possible thing that someone can do to themselves. And it is the easiest thing to reverse the risk. Once you stop smoking, over time, the risk goes back to that of a person who never smoked at all. So you really can change your future course by just eliminating the cigarettes.
You think it's easy to stop smoking?
It's not easy, but it can be done. A lot of willpower. And now we have, the gum and the patch and also medications that we can put people on to help them.
The most important thing is, me as a urologist tell them that you guys will become impotent. And then they are horrified to hear, which is true because it's a vascular disease.
Yes.
Just as the heart is affected, and the same way a lot of other body functions are affected. But we always talk about cancer of the lungs.
Right.
But smoking is bad for the entire body.
That's right.
So how about alcohol?
So alcohol...
Any Sardarjis are listening,
Alcohol is okay in limited amounts. So, 1 to 2 glasses a day is about as much as anyone should be consuming.
So what's your advice? How much should they do? And what kind?
Red wine is probably good because it's been shown to have antioxidant effects. And as I said, just 1 or 2 glasses would be the limit. And that doesn't matter whether it's a glass of beer, a glass of wine, or a glass of hard
any kind
liquor.
of alcohol, but limited to 2 portions.
Yes.
That is correct. Okay, what else shall we talk about? Let's say somebody has a bad history. Their father, their, other relatives, they died of heart attack. So obviously it is their body which is making the cholesterol. So what advice are you going to give them, and how will they know?
So people should have their...
Come to you, of course.
Should come to me.
Right.
Have their cholesterol screened. So we can do a blood test that can quickly show us all the different aspects of their lipid profile. And from that, based on their risk and risk factors, their history, we can tell them exactly what numbers they should target or shoot for. And we can treat the cholesterol with things like diet, and also with medication. And depending on how high it is, we might put somebody on diet and medication, or just one or the other.
Many times you hear, and Dr. Patel and I were talking about earlier, there are a lot of people say, oh, I do everything, I don't eat much, my diet is good, but my cholesterol is not going down. So those are the guys who should be taking medication.
Exactly. And many times it is genetic, and you can have a vegetarian diet and eat low cholesterol diet and still have high cholesterol and still be at risk. So those are exactly the people who should be on medication.
You mentioned a key word, different type of cholesterol or lipid. Just could you make it simple so that our audience could understand what are the different types? Because all of them have blood reports, but they don't know how to read it.
Right. So we usually break down a lipid profile into 4 main components. One would be the total cholesterol, and that's a number that we first look at to determine someone's risk. And that number should usually be less than 200. The next component we look at is called the LDL, and we usually refer to that as the bad cholesterol, the kind that causes the plaque and the hardening of the arteries. And that number should, usually be less than 160, 130, or 100, depending on your risk. The next thing that we look at is the HDL, which is the good cholesterol. This is the cholesterol that helps clean up the plaque in the arteries. And that number we usually like to be higher than 40 or higher than 50. And finally, the 4th component is called triglycerides, and this is another component of fat circulating in the blood, and that number we also like to keep, in the 100 range.
So in other words, total cholesterol can be good.
Yes.
But if the triglycerides are sky high, then they are still at risk.
That's exactly right.
So they have to look at all these numbers, not just at one number.
That's right. And there are different interventions that we can take and different medications that we use depending on which component of that profile is abnormal.
That's wonderful. So if you have your blood report, take it out and see what Dr. Narula told you, where you stand. So the medications. A lot of people say, oh, I don't take medication. They, in a way, think that taking medication is bad, and they have high triglycerides and things like that. So could you give them a little piece of advice that it is not being brave not taking the medication?
That's right. It's putting yourself at risk by not taking the medication. Obviously, every medication has side effects, and if we can, we try to avoid putting people on medication if they really don't need it. But for some people, it's absolutely necessary to start taking medication and to treat the abnormal cholesterol to prevent the plaque from building up in the arteries and lower your risk over time.
Well, that's wonderful. And what are the other things we should talk about in terms of cholesterol? Smoking we talked about, exercise we alluded to, and yes,
screening.
Dr. Patel has a point to
screening.
Yeah, and blood sugar would be the other, diabetes.
Yeah, that's right.
Yeah, that's the last important one.
Okay,
So we recommend that anybody who has a family history of diabetes or who's over the age of 45 should be screened with a fasting blood sugar for the development of diabetes or prediabetes.
I have noticed that at least in our community, the diabetes, the blood pressure, and cholesterol, all 3 go together. Somehow genetically we are more prone to it, it seems like. Then on top of that, you add smoking. And for certain groups, you put alcohol. So it really, the stage is set to have the cardiac problem.
That's right.
Okay. That also brings us, now let's say somebody already has developed a problem. And then you tell them, well, you have to go to Dr. Patel